Maryland has seen a steady rise in the rate of new coronavirus cases over the past 2 weeks. Daily numbers still remain much lower than levels seen over the winter, but the rise is enough to send the positivity rate back over 1%. The daily average of new cases over the past 7 days is 107, nearly double the daily average of 54 new cases nearly a month ago. As of July 12th, state health officials have identified 90 cases of the Delta variant. That's up from 69 cases of the variant on July 9th. Nationwide, the Delta variant is fast becoming the dominant strain driving infections. Public health experts stress there's no evidence vaccines aren't working.
I think we also have very strong circumstantial evidence that these vaccines are working, because even now in the US, where the Delta variant accounts for most of our infections, we're seeing that the vast majority of cases, serious cases, and especially deaths are occurring in people who are not vaccinated. So it looks like these vaccines are working.
Maryland's vaccination rate is among the 10 highest rates in the country. As of today, 57.45% of the population in Maryland is fully vaccinated. That does not include children under 12. But the rates vary widely around the state. Howard County leads the state with 66.7% of its population fully vaccinated, but 3 counties are below 40%. Cecil County stands at 39.9%, Garrett County 37.5%, and Somerset County's vaccination count is just 36%. Emerging now is growing attention to so-called long COVID, symptoms that hang on after infection, even among those who reported milder cases initially. A study is now underway at Johns Hopkins School of Public Health, headed by Dr. Priya Dugal.
About 30% of individuals who were infected with COVID-19 are reporting symptoms more than 30 days post their infection, some more than 3 months, more additional ones more than 6 months, and some people now reporting symptoms a year after they were infected.
2 questions that study hopes to answer: how and why does long COVID start? In East Baltimore, I'm Jane Miller, WBAL TV 11 News.